Endometriosis is a disease that affects approximately 1 in 10 women. That's roughly around 190 million people worldwide.
But it's still often misunderstood and misdiagnosed. And here to tell us more about endometriosis and its impact is OBGYN Dr. Marjorie Dixon. Welcome to the show. Good to have you back.
It's good to be here.
Good to have you here. Okay, I think we start with the basic question. What is endometriosis?
So endometriosis is where the same cells that are inside your uterus, endometrial glands and stroma, are growing outside of the uterus. The issue is when you bleed, it comes out your uterus, right, out of your vagina. Inside your pelvis, it festers and it causes inflammation. And people have a lot of pain and discomfort that makes it really unbearable for your period. So they have crazy painful periods.
Yeah, I mean, can you talk a little bit more about those symptoms of endometriosis?
Yeah, so I mean, you know, people have painful periods, but they explain when patients have painful periods with endometriosis, patients describe it as if they have glass in their pelvis.
Oh, wow.
And they end up sitting at home. They can't go to work, can't go to school. It interferes with your activities of daily living. And then it's everything. So when you have to have a bowel movement with your periods, it's extraordinarily painful. If you have menstrual cramping, it's next level. If you have to have void or have to have pass urine during your periods, it's extremely painful. Wow. Your periods can be very, very heavy. You also get what they call endometriosis bloat. So because of all the inflammation inside of your pelvis, you sort of have a bloated belly because it's a lot of pain and stickiness. Yeah. And from a doctor perspective, it gets confounded. So it gets confounded with irritable bowel syndrome, or people say that you have PID, maybe you have an infection. It really is important for patients to link it to their periods. So keep a journal and know how it relates to your cycle.
Yeah, and why is the diagnosis so difficult to?
Well, because it masquerades as other things. And so you really have to, we have totally normalized pain for women, pain with their periods. So, you know, everybody's shaking their heads, right? Yeah. So when you have your period, it's supposed to just come and go and you bleed and it lasts a couple of days or 3 to 5 days. When people have endometriosis, it is debilitating. And so they can go to their family doctor, and family doctors that are woke will say, maybe I need to refer you to a gynecologist, or maybe we can talk about, I'll try this pain medication. If it doesn't work, then maybe you need to see a gynecologist where we talk about other things. The thing is they get referred for other instances. So they get worked up by a gastroenterologist, or they get worked up by a gynecologist for infection. They get referred for the wrong thing. So it really takes a long time. It takes on average 7 to 10 years to get a diagnosis.
7 to 10 years.
That is...
Wow.
If a man had it, it'd be cured. But anyway, moving on. It sounds like this is not just debilitating for in the moment and maybe cyclically. What impact does endometriosis have on our overall health?
Well, I mean, on your overall health, it's women sometimes with endometriosis will plan their entire lives around their periods or events to not be at their period. It interferes with, it comes into everything that they're thinking about, like, okay, so my periods are flooding, so I'm gonna wear black pants and I'm gonna make sure that I'm close to a washroom. It affects every single decision that people make during their month. Sometimes people have chronic pelvic pain and they don't know that they have it. They have to be sent to someone. They end up having a little surgery, it's better, and they're like, it's endometriosis.
What kinds of treatments are available, if any?
Yeah, so you can suppress it. So one, you can deal with pain. So sometimes you get like non-steroidal, we call it non-steroidal anti-inflammatory medication. So there's specific sort of anti-inflammatory pain medications that work better than sort of a Tylenol. Then you can also suppress the endometriosis. So you give hormonal treatments. Also, if you're having the super heavy periods with it, you can put an IUD in. A lot of women have this misconception that an IUD is just for contraception, but that can also really help make your periods much lighter, so you're not trying to manage your bleeding every day of the month as well when you get your period. Yeah.
I understand that endometriosis can also affect your fertility. So if someone has endometriosis and they're trying to get pregnant, what advice do you have? What's the best approach for them?
So 30 to 50% of women with endometriosis have infertility. And as an infertility specialist, that's where they get referred to me. I see women with endometriosis weekly. And it depends on sort of the stage of disease, how badly it affects your fertility. Can you have a baby with endometriosis without intervention from a fertility specialist? Absolutely. But once you have sort of stage 3 or stage 4 disease, that's where you need intervention. So it's important when you have a gynecologist who's dealing with it to decide what's the pathway, what's the issue. Is it your pain? Or is it your fertility that needs to be managed? Because there are different approaches for both. And the physician actually needs to take into time and consideration what your main pain point is, and if you do need referral to a fertility specialist. So not every woman, the main thing to say is that not every woman with endometriosis will need a fertility specialist, but you need to consider it with your approach, because sometimes when you have surgery for endometriosis, so say you take out a cyst on an ovary, that's one of the things that you can see with endometriosis. You take out a cyst, you can take out some of the important little cells that are for growing eggs later on. So you need to have a physician that'll say, okay, I'm going to maybe do surgery, but I'm going to refer you to a fertility specialist so we can work together collaboratively to get the best outcome from a fertility perspective.
There was absolutely. Recently on social media, there was a trend, and patients with endometriosis, they were connecting their scars, and then they posted images online calling it #ThisIsEndometriosis. Now, what is the impact of this on increasing awareness?
I think it's huge because, until we talk about it, it doesn't become real. And having this Endometriosis Awareness Month is tantamount to that idea as well. People recognize how frequent it is. It's 1 in 10, you said before. 2 million Canadians are living with it. It's not a small problem. And because, again, period pain is undermined, it is debilitating to so many women. It is important for women to be able to recognize it, to say, I saw this thing on social media, and you miss work 2 days a month. Like, maybe this is something that you have. It really does help rally troops and get people talking about it, and then talking to their physicians about it. Sometimes physicians also need some awareness, right? So it empowers people to say, this is my body, I know this is wrong. Is this endometriosis?
Yeah. Thank you so much for this conversation. This is why we need you here.
It's awesome to be here.
Yeah, thank you. Thank you for coming. All right, we hope that you spread this information to the women in your life.